So the single most important thing that a patient should know when we crash into the ER and the doctors come to us and say, "Man, I think you have some type of form of nephrotic syndrome."
Yeah, that's a tough one in terms of the key thing. I guess knowing that this may be unfamiliar to many doctors uh, is a key thing. And a lot of the work, initial work may need to be done by you, the patient. Um, I've had some people that have diagnosed rare disorders just by Googling their symptoms,
Right.
and I think if people are noticing that they're having weight gain, leg swelling, bubbles in the urine that weren't there, and you put those into Google AI search or something, that's going to quickly come up with, okay, you may have the nephrotic syndrome. And there are multiple different causes, um, some of which have blood tests, some of which don't. But I think it's important to try to let your doctors know that the symptoms may be starting in the urine, right? Because a lot of people show up to an emergency room and have leg swelling, and they'll get an echocardiogram because they're wondering if they're in heart failure. I've had people go through multiple tests, CAT scans of the body, looking for cancer obstructing their, flow of
That happened to me. They were looking
blood
for a
back.
kidney stone that was a fully blocked kidney stone that didn't exist because they're like, you're just swelling with water and it won't stop. So we don't really understand. There must be something blocking it. And that didn't make sense to me. As an uninformed patient, it kind of made a little sense. And that's what got me to the ER in the first place. But yeah, I can totally relate to that.
So I think understanding that an ER doctor might not put things together, because you really have to test the urine. If for whatever reason you get a little dipstick test of the urine, or because you've had abnormalities, sometimes there's even a little blood that's microscopic and detectable. um, that's not always done. So if you've noticed urinary symptoms, ask to have your urine tested, because the amount of protein is usually massive, and that will lead doctors down a pathway. There are certain blood tests like anti-PLA2R, but also some other routine tests we do for glomerular diseases that can be done. It's not going to find non-PLA2R membranous. It's not going to find FSGS yet. There may be a up and coming test for other autoantibodies, um, but there are a lot of nephrotic syndrome disorders that need a kidney biopsy. Um, and the blood clot you mentioned, someone as may show up with a pulmonary embolism, a life-threatening blood clot that has traveled from the lower extremities or even the veins of the kidneys to the lung, blocking blood flow through the lung. And there are other, there are blood causes of that. People don't always think that this could be the nephrotic syndrome. So piecing together these puzzle pieces, hopefully the doctors will think of that. But, in my experience, having seen a lot of patients with membranous nephropathy, that's not the case. So being your own advocate, being curious about your symptoms, I mean, with everything that's available in terms of AI and
Yeah.
ChatGPT, and just Google now seems to be
Yeah. So
everything
that's
is